My name is Dr. Pankaj Wadhwa. I'm a urologist with special interest with treating stones in the urinary tract. Stone disease India में बहुत common है. It is so prevalent and in fact increase कर रही है because हमारी जो lifestyle है, हमारे fluid drinking habits हैं, हमारा dietary pattern has been changing so much. We drink less water than before. We rely more on processed food and a lot of carbonated drinks. All this actually increases the chances of forming stones in the kidney. There's a geographical pattern also. Kidney stones are more common in the northern and the northeastern part of India. South India में भी increase हो रहा है. One of the reasons is again a change in diet. More salt intake does cause more stone formation. But the crux is more water intake is required. At least 12 glasses of water is found to be helpful in preventing stone disease. Less salt in diet is recommended not only for the heart but also in preventing stone disease. There is a myth always that those who have stone disease should not have milk. It has been shown by a lot of research that 2 glasses of milk is generally good for the body because उससे bone health ठीक रहती है and it has been found to reduce stone formation actually. So zero milk is not a good policy. Having a mixture of all kinds of vegetables is recommended. Plenty of fresh fruits is recommended. जिनको specifically कुछ बीमारियां हैं, diseases like bone problem or intestinal problem, they have a bigger problem in terms of their dietary intake. उनमें oxalate rich diet avoid करना चाहिए. Oxalate rich diet होता है lot of pistachios, lot of kajus. This is amongst the dry fruit. A lot of green leafy vegetables. उन patients में बहुत ज़्यादा मायने रखते हैं. But general public में green leafy vegetables actually healthy हैं. A balance is actually more important. If we take adequate milk-based diet with our green leafy vegetables, जैसे दही with say saag, it actually is beneficial and stone formation will be prevented. The third important aspect is regular exercise. जो देखा गया है, diabetics are more prone to stone formation. People who are less active physically tend to form more stones because उनमें जो calcium है urine में ज़्यादा गिरता है. So there is more hypercalciuria. There's also a genetic component to this. So in northern India, almost 15% people have a genetic tendency to form stones. उनके लिए एक तो evaluation बहुत important है. History is a very important thing. घर में किसी और को stone का problem है या नहीं है, और अगर है, their evaluation metabolically. Stone disease एक metabolic problem है. So metabolic evaluation उनमें बहुत ज़रूरी हो जाता है. And if we can correct the metabolic problem, then the chances of a stone formation reduces. जब stone बन जाए, one has to take care of it before, because when it is small and when it is in the kidney, minimally invasive treatments are available, like shockwave lithotripsy for a small stone which is less than 10 millimeters. It is fairly good to do. If नहीं तो अगर वो अड़ जाए ureter में, that means it will cause hydronephrosis or swelling of the kidney, which will potentially damage the kidney and cause renal failure. In that case, we may need to do a ureteroscopy. Sometimes we have to make a hole in the kidney, which is called a PCNL. But with improving technology, ये जो hole size has been reduced remarkably from almost a centimeter down to about 4 millimeters. एक और टेक्नोलॉजी जो हमारे पास अब अवेलेबल है वो ये है retrograde intrarenal surgery, which is flexible ureteroscopy. That means we can go in through the natural urine passage all the way back into the kidney, treat the stone in the kidney and take it out, or at least pulverize it to fine dust using a laser. So ये जो options हैं, these are to be tailor made according to every patient. The requirement of each patient is different. Each stone is to be treated on its own merit, depending on its size, its location, the patient's profile. Is the patient got a lot of other problems like diabetic hai, heart disease hai, is the patient pregnant at that point in time? So these are called patient factors. Medically, stones treat तब किए जाते हैं अगर if there's a small stone which is less than 5 millimeters which is stuck in the urine pipe or the ureter, it can be treated by medical expulsion therapy and for about 2 weeks. But one should remember that if the stone does not come out in 2 weeks, it should be treated, otherwise it will cause damage to the kidney.